So it's now been confirmed that we have a person within our country who has tested positive to coronavirus.
I think in the beginning, South Africa did really well at a lot of things, but unfortunately, as it turned out, it was just bad luck that the things that did well, it didn't really help a huge amount. There's a lot of staff anxiety in the beginning because of the fear of catching COVID, the fear of getting ill in the line of duty, so to speak, and again, not made better by the unknowns. And many people, wondering how they can protect themselves and who's going to get sick and etc.
And then yes. So let us.
We used to get most of our PPE from Europe, and Europe had just been hit with COVID just before us. So all their PPE was in Europe, and they were using it themselves, and we struggled to get. And that added to the anxiety because we were very much touch and go as to whether we'd have, say, enough masks for our healthcare workers. And it's difficult because I think you have every expectation to say that if we give appropriate PPE to healthcare workers, they must work and they must do their job because that's what we all signed up for. It's different though if you don't have PPE. That's asking a lot of people to walk into a room where they can easily get infected.
Right.
Had we had more people vaccinated by the third wave, for example, we would have saved a lot of lives. So many people who, it's a very tragic thing to be staring at someone who's struggling for breath on a ventilator when knowing that the vaccine actually was available to them and for whatever reason, they didn't get it. And it may not be their fault. Maybe they just the access wasn't good enough, or maybe they had doubts that weren't delayed, or for whatever reason, but they could have had it in theory. It's available in the country. And we were seeing people coming in and dying who didn't need to die. If you see Omicron now spreading through the world, every country gets the same picture of their waves. You really just can't slow it down. And that's because it's so much more infectious than the beginning waves, which the previous virus.